We've had a really inspiring and really invigorating day today with over 100 participants who really very actively, meaningfully contributed, asked, ran workshops, told us stories, gave us examples of how and why individuals and the communities are much better at protecting health, improving well-being and creating health, much better than the individuals, professionals sitting in different hospitals, meeting rooms, etc.
So the most important thing I took away from today's social model of health and wellbeing event is that we need to be more about community development and not just about service development.
The social model for health resonates totally with the Wellbeing of Future Generations Act. It's about working on the wide social determinants of health and the well-being goal. It's about, working on what keeps our current generations healthy, but also in a way which will deliver for future generations too.
It's living conditions. It's what happens in early childhood, in education, in employment. How much money people have, do they have enough to live on? The general environment. Those are the things that are absolutely crucial. And the social model means bringing the people who are concerned with those things together, to work together, to create better living conditions for the community and hence better health.
It's already happening in our patch. Here in the John Burns Centre we can see a coming together of community, private industry, philanthropy that really captures the essence of what we can see is the development of a thriving opportunity for community to develop and be healthy together and celebrate that life, because all of us have gone on that journey. All of us have got different resources, different opportunities, diversity in our experiences. And our process here today is very much about organisations coming together with community and thinking about practically looking at our community, looking at the incredible assets that we've got, like the John Burns Centre, and building on those for an even better and brighter future. And I think that's definitely what I'll take away from today.
My takeaway from today's event has been how great it is to see that the Health Board is taking seriously and committing to the social model and has brought people together, like-minded people, to start looking at how that can be implemented with some practical solutions, but also really looking at the long-term effects that we want to bring in so that people's health and well-being is going to be better in the future. The challenge is enormous, but I think it can be done, particularly if the partnerships are built on. It's been an inspiring and excellent day.
That's what the principles of social model are, to really take action, be bold, think outside and recognise that most of our health does not come from going and seeing a GP or going to hospital. It comes from how active we are in our communities.